Welcome to the ABCs of high blood pressure. So today we're going to be talking about what blood pressure is, what causes it, and how to take care of it. But before we get started, just a few housekeeping things. You have a few sheets of paper in front of you. The first one is your consent form. We're in a group visit and we want to make sure that we're keeping everybody's information private. The second sheet is a questionnaire, and at the end of this visit, complete that for us. We really appreciate your feedback. If you have questions, please ask your questions. This is a time for you to have your questions about high blood pressure answered. Everything is going to be confidential because this is considered a medical visit. Also, just participate, share your questions. The question you might have might be the same question that somebody might benefit from hearing the answers to. Because we're in a group visit, we want to make sure that we are respectful of each other. Please turn off your phones. Wear your mask. We are still in a pandemic, but it's also optional if you do not want to. We're going to start by talking about stress, but before we talk about it, I'm wondering, how do you experience stress in your body? We would like to share. Headache. Thank you so much for sharing. Who else? Anxiety. What else? Thank you so much for saying that. Restlessness. And stress is basically your body's response to a challenge or a demand. Stress in itself is not a bad thing. So for example, if I was walking down the street and a car was coming close to me, my stress response would kick in and I would jump out of the way. That is actually a good thing because it can save your life. Stress becomes an issue when we have stress all the time. And that is what we call chronic stress. So if I'm waking up stressed, I'm going through my day stressed, I come home stressed, and I'm going to bed stressed, right? Over time, that is not good for our bodies. And so too much stress can actually lead to problems all over your body. But today we're talking about your blood pressure. So we do know that elevated stress can damage blood vessels, which can lead to high blood pressure. It can also increase your risk of a heart attack. It can increase incidences of headaches, anxiety, sleep problems, such as insomnia, as well as weight gain. Did anything on there surprise any of you? No. Yeah. When you have stress in your body, how do you manage your stress? What do you usually do to make it better?
Have a cocktail.
Have a cocktail. What else? Who does something else?
I actually meditate. Just quiet time.
Quiet time. That is a really good way of calming the body down. Who else wants to share?
I like to go for walks.
Going for a walk. Thank you.
Massage therapy.
Massage therapy?
Yes.
Oh, wonderful. I want one of that too. But there is no one way to manage stress. What works for you might not work for you. What we say is to have tools in your toolbox. And sometimes walking might work. And sometimes meditation might work for you. Other times, prayer might work. For some people, things like yoga and Tai Chi, even just listening to calming music. All of those are various forms of managing your stress. We're not able to get rid of stress. If you packed your bags and said, it's too stressful in Minnesota, I'm going to find a beautiful island, you might be relaxed for a while, but one day a hurricane might show up and you'd still find yourself stressed. So the idea is that you're not able to completely get rid of stress, but you want to be able to manage your stress well. Part of managing stress, there are lots of ways of doing that. Peggy mentioned meditation, calming down. We do know that when we're more calm, we're much more likely to see our blood pressures lower. So take, for example, when you're coming to the clinic, you're rushing to get there and you can't find parking, you run in to check in, you don't have a moment to rest, and then they call you into the room. Usually the process of getting here is stressful. But we do know that if you can take some time to relax, the blood pressure reduces. Right now, we're going to take some time to calm down. Who here has ever done breath work before? So, if you close your eyes, get very comfortable in your seat, and let your back relax. You can close your eyes or you can sort of maintain a soft gaze. And I just want you to observe your breathing. Observe what it's doing. Is it shallow? Is your heart beating a little bit faster than normal? Just observe what's happening in your breath and in your body. And when you're ready, I want you to start to deepen your breath. So inhale just a little bit slower. And then exhale when you're ready. As you inhale, I want you to observe the cool air going into your lungs. And on your exhale, notice the warm air coming out of your nostrils. Continue to focus on your breathing. For the next breath, I want you to breathe really deeply until you feel your belly expand like a balloon. And then exhale gently. As you continue to breathe, now I want you to just notice different parts of your body. Maybe starting off with the neck. Think of what's happening there right now. Some of us carry a lot of our stress on our necks and shoulders. Observing is not about fixing, you're just noticing how your body is feeling at any particular moment in time. You might do a little stretch to the left or to the right, and just continue to focus on your breathing. Now bring your awareness to your shoulders and notice how they're feeling right now. Continue to observe different parts of your body. As you inhale, imagine all of that air just filling up every part of your body. And on your exhale, let go anything that could be considered negative in your life at this moment. So whether it is stress, deadlines, whatever it is, just let it go. Give yourself permission to be fully present at this time. And then on your next inhale, imagine that air just filling up your heart space. And then exhale. In the next few moments, you can take in a few more deep breaths. And then let your breath return to normal. You can take one moment of silence and think of one thing you're grateful for in this moment in time. And when you're ready, you can bat your eyelashes open and come back to the present. Thank you. How was that for everybody?
Relaxing.
All right, wonderful. Mindfulness can be done wherever. A mindful practice doesn't have to be a long 1-hour exercise. If you find yourself stressed at work, you could take a moment to breathe and to relax. If you're driving on the highway and you're stressed about traffic, you can take a moment to breathe and to relax. I appreciate all of you participating and taking the time to be here. Up next, I am going to call on Dr. Gilliam. He is our medical director as well as a family physician here at NorthPoint, and he will come to talk to you about what blood pressure really is.
I don't know about you, but I am much more relaxed than I was when I walked in after doing that mindful moment with Solange. As she mentioned, we're going to talk about what blood pressure is. All of you had your blood pressures checked today, and when we checked it, there was a top number and there was a bottom number. And so you're like, well, what do those numbers mean? What those numbers are the systolic number on the top and the diastolic number on the bottom. And what they represent is a measurement of the amount of pressure, the amount of force inside the blood vessels. So when we look at the systolic blood pressure, which is the one on top, the way I like to explain it is using a balloon. Has anyone ever used a balloon or seen a balloon? See? Got a balloon. Right. I just want to make sure everyone's on the same page. When you think about it, there are a few things you have to do generally. So you stretch the balloon out a little bit, and that kind of loosens it up. So we're using this balloon to represent our blood vessel. So you loosen it up a little bit. So what we do with this balloon is generally when you blow up a balloon, you put air in it. So the amount of force that I needed to get this balloon to expand is what we will call the systolic blood pressure. So that's the work of the blood pressure. Now you notice when I took a breath, I had to hold pressure on the balloon, because what happens if you don't keep your mouth on the balloon and you take a breath, you lose air. When I held pressure, that is the relaxation pressure or the diastolic blood pressure. So when I push air in, that's the work. When I am taking a breath and relaxing, that is the relaxation. So systolic, diastolic, work, relax, work, relax. So that top number is the work number, that bottom number is the relaxation number. I want to let the rest of this out. So when we think about it, there are some people whose bottom number is just as high as other people's top number. So some people walk around with a blood pressure of 220 over 110. So what do you think happens if a person's heart is just working nonstop, 24 hours a day, 7 days a week, 365 days a year? Work.
It's gonna need a break.
It's gonna need a break, right? Because that's how, if we work 24 hours a day, 7 days a week, 365, what happens to us?
Tired.
We get tired. We'll give out. So that's why we like to address the blood pressure, because we don't want people's blood pressure to be so high that their heart never gets a break. It's the heart's job to always beat and to be with us from day one, but we don't want to make its job any harder. So that's why we talk about blood pressure. There are a few things that can cause your blood pressure to be high. So there are some things that you can do some stuff about, and that's what we'll talk about mainly today. And then there's another group of things that we can't really change much about. Our families, we can't do anything about them. They're yours. Your age, you get older and older, can't do anything about that. We do know that the older we get, the higher the risk is for us to get blood pressure. And the other thing is our gender. So men generally are at higher risk for developing a high blood pressure before the age of 54. Between 54 and 65, it's about equal between men and women. And then after that, women have a higher risk of developing high blood pressure. African Americans have a higher risk of developing blood pressure, and there are a lot of different factors that play into that, including institutional and structural racism and a lot of other things that society was built upon. But we're not addressing any of those things today in this class, but we'll address the things that we can do with physical activity, so exercise, diet, weight, alcohol, sleep, and many other things. So the first thing I want to talk about is really giving you an outline of what the categories of blood pressure are. So where we want to be is in the green. So you want your systolic or top number to be somewhere less than 120. You want that bottom number to be somewhere less than 80. So we're looking to get those numbers less than 120 over 80. If you get a little bit higher than that, so if your systolic is somewhere between 120 and 129 and that bottom number is still below 80, it's in the yellow zone. So just kind of keep an eye on it. If you get higher than that, so if you're running 130 to 139 and that bottom number is now 80 to 89, we're really starting to pay a lot more attention, and you've kind of crossed over over into what we call stage 1 hypertension or stage 1 high blood pressure. We used to think that was more normal, but as we learned more, we realized we needed to lower those values to when we really start paying closer attention to when to kind of intervene. In these ranges is when we would really engage with you around your diet, kind of lifestyle things, and make sure that there are some things in your life that you could change that would help to lower your blood pressure. Once we get above 140 on the top and above 90 on the bottom is when we really start considering whether we should start a medication in addition to all the things that we've done to kind of help change things about your life and how you engage. And then once you're above 180 on the top and above 120 on the bottom, we're definitely considering blood pressure and would highly encourage it, in addition to, because medicine alone won't get the job done, you also have to do the other things to get your blood pressure where it needs to be. So you didn't realize this, but we were going to have a little bit of a quiz. So I hope you were paying attention just a second ago. So if we start at the top of this list and you look at that first one, 142/80, is that high, normal, low?
High.
High.
Very good. Yes. 180/110.
High. Extremely high.
Yes. You guys are good. You were paying attention. 128/78.
Normal.
It's elevated, it's high.
It's normal.
So there's some difference of opinion. I'd agree. So that bottom number is good. Top number is a little elevated. You're right. So that's, that yellow zone. So it's kind of a little so-so. 120/90.
Elevated.
The 120 is good, but the 90 is too high.
Correct. It's elevated. They both have to be normal for it to be normal. 150/78. Very good. 140/90.
High.
All right. And 112/78.
Good.
Good. So usually some people will say that's low. It's not. It is a perfect blood pressure. And why I bring this up is that some people say my blood pressure is too low and they will stop taking their medicine at this point. But you should continue taking your medicine if your blood pressure is there, because that means it's working. Now, everyone's blood pressure is different for them. There are people, their blood pressure might be 90/60. If my blood pressure was 90/60, you'd be helping me get up off the floor, because you need your blood pressure to survive and to support you kind of moving around and doing your daily activities. So that is a great blood pressure, and everyone's blood pressure is based on who they are as a person and kind of what their body is like. So we checked your blood pressures earlier, so now you've warmed up with this quiz. We'll now kind of talk about our blood pressures from today. So this first blood pressure, 120/80, I believe this is you. Is this high or normal?
Normal.
Yes. How did you get your blood pressure where it is?
Well, I recently started meditating. I exercise regularly, and I've decreased my salt intake.
Very good. So you were really engaged when Solange was doing her part with the meditations, and she just started. So that's excellent, and that lets us know that those things actually work. So thank you. And then 122/76. Do you think that's normal or high?
I think it's normal.
Mm-hmm.
So I don't take medication,
Yeah.
but I am exercising
Mm-hmm.
and changing my diet. So
Yeah, I think I agree. I think that's normal, and definitely not being on medicine and keeping an eye on it and doing the things you've done. I'd expect that to stay where it is. Good, thank you. And the next one is 136/84. And what do you think about that?
That's high.
Yeah. Why do you think it might be a little high?
Because it's not 120, the normal number, or it's higher than 120.
Mm-hmm.
And then the lower number it's not 80.
Right.
So those are what I consider as normal,
Mm-hmm.
those two numbers. So it's high or elevated.
Yeah. Is your blood pressure usually in this range, or?
You know what? Normally, it's a little higher, so it looks better today than normal. And I have made a few changes. So I don't take it. My salt intake, I've decided to decrease it. So that's what I'm seeing.
Yeah. So I think if typically you're a little higher than this is a good place to be, particularly given that you've made changes and your salt intake. And as we go through talking today, picking out some things you might be able to do in addition to help to lower it even further. But I think this is if it's better, That's good. 162 over 96. Do you think that's normal or high?
It's really high. I need a refill on my medication. I haven't slept well in weeks. My son just moved in and he's stressing me out.
Yeah. Stress is a major cause of elevation of blood pressure. And if you're prescribed medicine, not being able to take it or not having taken it will result in that blood pressure being a little high, and maybe even higher if you are feeling stressed in the way you just described. So I think we can make sure you get your refill today so we can get you back on your medicine, and then also get you arranged with your primary doctor to make sure that comes down. Good. Thank you. The next one we have is 118 over 78. Do you think that's high or normal?
It's actually normal.
Yeah, great.
It's a really good blood pressure. I've been taking medication, exercising, and I've been sleeping better at night.
Well, good. I neglected to mention this earlier, but sleep is incredibly important to making sure or helping that blood pressure to remain low. Because if you slept an hour or two, not only is that increasing your mental stress, but your body needs sleep in order to recover and repair itself at night. So it's really, really good that you're focusing in on your sleep as well. Thank you. The next one is 150 over 92.
Yeah, my blood pressure is a little bit high. I also didn't sleep well last night, and I just forgot to take my medication, and I had to juggle through, being a full-time student and part-time job too, and getting where I need to go, and then just not really finding time to sleep.
Yeah. I think doing our best to kind of take care of ourselves with those essential things like we've mentioned before, particularly with sleep, even when the stresses of life are kind of pulling in different directions, because it can result in the blood pressure being a bit higher. And, so hopefully we can kind of help you work on some ways to restructure your schedule to help you to engage a little more in some more quality sleep. And then the next one is 126 over 86.
I think it's kind of high than usual.
Yeah. Why do you think it's there?
Because maybe because my back started hurting today. I don't know what's going on. Maybe I slept wrong. Just probably strained my back.
Yeah.
Something like that.
That's a good point to make, because mental stress is not the only type of stress that can cause the blood pressure to go up. Physical stress can do the same. So if you have an ache or a pain, your blood pressure naturally responds to that and it will go up. Even if you bump your knee on the table sitting there, your blood pressure, your heart rate will jump up just a little bit. So even though it's a little high, if it's typically lower than that, then I wouldn't be terribly concerned about that, but I would keep an eye on it. And last but not least, 144 over 88. What do you think about that?
I think it's high.
And
yeah, it was hard. I had a hard time finding parking.
yeah.
And that stressed me out, so I decided to smoke a cigarette.
Yeah. So that's two things: the mental stress of trying to find a parking space, getting stuck in traffic, having an argument with the kids or a significant other. We'll encourage you a little later and also right now to stop smoking if you can, or reduce, because when you do smoke, that can increase the blood pressure as well, because the chemicals in a cigarette kind of tighten the blood vessels. And so when we talk about the pressure in those blood vessels, it just increases it. So doing our best to do that. Thank you. So as we move forward, so you guys kind of aced, you guys kind of got this down packed on what the categories mean. And so great job. So before we get to the things we can do to change some of the things in our lifestyle, we'll talk quickly about the consequences of having an elevated blood pressure for a long period of time. And we really start from the top of our heads to our feet. So when we kind of think about the brain, which is in the head, if the blood pressure gets too high in those blood vessels, you can get a stroke. And that's, one particular type of stroke when the pressure gets too high. Yes, ma'am.
Is that the reason why when some people's blood pressure is extremely high, they complain of a headache? Is that potentially the reason why?
I'm glad you used that word potentially, because it's a kind of chicken and egg type of thing. Because sometimes, did your headache cause you to have high blood pressure? Or did your high blood pressure cause you to have a headache? So yes, some people, when their blood pressure gets too high, they can get a headache. But also, if I have a headache and that's pain, so we talk about physical stress, my blood pressure will go up. So that's a good question. It doesn't necessarily mean that that person is going to have a stroke if their blood pressure is high, but when it gets extremely high, it can result in a stroke. As we move a little lower, so we think in the eyeballs, there are little blood vessels in the back that if the blood pressure gets too high in those, they can break, and that can cause a decrease in your vision. So it can cause you to lose vision, which is different than glaucoma, which is an increase in pressure in the eyeball. They're related to each other, but it is not high blood pressure in the way that we think that we're talking about it today. And then if we move a little further down, when we get to the level of the heart, so we think about two things. So the function, the reason the heart exists is to pump blood. And so the heart is brilliant in that it gives itself blood first before it gives blood to anywhere else in the body, because it knows it needs to be healthy in order to serve the rest of the body. And so if the pressure gets too high in those blood vessels that give blood to the heart itself, they can break, and then you can have a heart attack. And so then that part of that muscle, that's the heart, loses its blood flow and it can die. And so that is what a heart attack is. So the function of the heart, though, as I mentioned, is to give blood to the body. So as I'm moving around, I like to move my hands when I walk around, and I'm kind of moving my legs and things, and my heart is increasing its flow to my legs and my arms, my vocal cords and all that. So, but if it can't keep up, so it can't get its job done, then all of a sudden, I need to stop, let my heart catch up so that it can catch up with what I'm asking it to do. And then once it does, I can get back to my regular activity of walking, talking, moving my arms. Because if I have heart failure, so it's failing at what it's meant to do, then it can't keep up with what I'm asking it. And as we keep moving down, we get to the kidneys. And the kidneys are essentially big filters of all the blood, but they're kind of millions of tiny little filters, and every ounce of blood cycles through the kidneys and it gets filtered of all the toxins and things. So if the blood pressure gets too high in those little filters, they can start dying off. And if too many of them die off, you get kind of kidney disease, kidney failure, and if you get end-stage kidney failure, that's dialysis. So your kidneys no longer work, and that can often be a result of high blood pressure for a long period of time. And then as we move even lower, yes, ma'am.
Saying high blood pressure for a long, are you saying uncontrolled high blood pressure for a long time? Because you can have high blood pressure for a long time and never go into kidney disease.
That's correct. I think there's a point you're making is a good one. We all have blood pressure, and it's normal to have blood pressure. Like, you have to have it. And if that blood pressure is higher than it should be, and everyone's different. So someone could have high blood pressure, 160 over 100, 4, 5, 10, 15, 20, 30 years. We don't have a crystal ball, so we don't know when or how that might impact a person. But someone else might be more sensitive to a blood pressure in that range and start getting more complications early. So since we don't know, we can't tell who is who. Right. So we try to get everyone's blood pressure within a normal range that we have realized is the kind of safest range for people to have.
So if it's controlled within a normal range, you're
Right.
less likely to end up with kidney disease.
Right.
Okay.
And so we would just call it blood pressure at that point. It'd take off the high. And so as we move a little lower, that's a good question, sexual dysfunction. And we tend to think about this mainly with men, but the arousal response is blood flow mediated as well. And so if those blood vessels get damaged, it can decrease arousal as well. So that's both men and women. And then as we move even lower, so into the legs, and the blood pressure gets too high in the legs, so when you're walking around, like I mentioned, your heart is pumping blood all over. But if those blood vessels in your legs are narrow and that blood can't get to your muscles, then your muscles start cramping. So after you've walked like a block or two, you get cramps in your leg and you gotta sit down and rest to allow that blood to catch up and get into your muscles, and then you can walk another block or two and then you rest. And that's called peripheral artery disease. Yes, ma'am.
When do I know I should call my doctor about my blood pressure?
Well, if I know you have a primary care physician, but if you did not have one at all, I would just advise getting in to see a doctor if you don't know what your blood pressure is. But knowing that you do, and you've been checking yours at home, if it gets higher than your typical, or if it hadn't quite gotten to normal yet and you hadn't been in a while, kind of reconnecting with your doctor to make sure you've gotten it kind of where it needs to be.
But if I have a headache or if I have cramps, I mean.
Yeah, I think any new thing that might come up, so if you kind of going through your daily life and things have been great, then all of a sudden you start getting headaches, or all of a sudden your stomach starts hurting, don't ignore those things. And so anything new that pops up, if it sticks around longer than you're comfortable with, I would just connect with your doc and just kind of get their advice, or kind of get in for a visit to get it checked out. Yeah. Yes, sir.
So we're talking about high blood pressure. What about low blood pressure? Does it have the same symptoms too, or effects?
It's a good question. It does not. High blood pressure generally does not have any symptoms. What we just talked about are the consequences of having extremely high blood pressure for a long period of time, but most people won't tell any of these things until it happens. And so they call it a kind of a silent killer. Low blood pressure is different in that if your blood pressure gets too low, if anyone's ever bent over to tie their shoes and then stood up quick and then got lightheaded for a second, that's your blood pressure dipping a little lower than your body's used to. And so that would be low blood pressure. And that usually recovers because that happens to everyone. And so that's some of the difference there. So as we keep on chugging along, we'll talk a bit about some of the lifestyle things we can do. So some stuff we can change. And what I'd like to start with is sleep. Because it tends to be the last thing we think about, but it is one of the most critical things we can do, is trying to engage more in our sleep. So generally it's recommended that you get somewhere around 8 hours of sleep a night, and doing your best to get as close to that as possible. And so if someone tells you, 4 hours of sleep, I'm good to go, I doubt they're telling you the full truth. All of the experts all agree somewhere between 7 and 8 hours of sleep is what we need. Now, we may not always get that because of different things pulling us in life, but kind of doing our best to get that many. So get more sleep. And then you want to improve the quality of that sleep. So you want to be consistent. Try to go to sleep around the same time every day. Try to wake up around the same time at night. So, yes, ma'am.
Can you get too much sleep?
No.
If you ask my teenage daughter, no.
No.
But there's a sweet spot, I think, in terms of how much sleep you would get. But trying to be consistent with how much you're getting. Sometimes we get a little more when we're behind on sleep, but just trying to be consistent with the numbers.
Can you catch up though if you feel like I didn't get to bed early enough? And can you make it up? He's like, I'm gonna sleep a little later because.
Not really. Once you've lost it, you've lost it. But doing your best to be as consistent as possible with the sleep you're getting. Yeah. And so we want to be consistent, like we mentioned. And then you want to set yourself up for success. So wherever you're sleeping, try to make it quiet, dark, relaxing, and get rid of the screens in the room. So try not to sit there with the computer or your laptop. And also have your room at a comfortable temperature. So if you're sleeping in the space by yourself, you get to pick what that temperature might be. If you're sharing that space with someone, you get to negotiate what that temperature would be, and I'll leave that up to you. And then, trying to avoid eating dinner late or a large meal late, drinking caffeine late. Some people say it doesn't bother them, but it does kind of throw off your sleep rhythms a little bit, kind of keep you from getting kind of deep into that sleep. And then alcohol can do the same, shifting how much of the deep sleep you can get and other types of sleep that we need to recover. And then getting some exercise during the day. So if you expend energy during the day and you're a little more tired, it just helps you to sleep a little more soundly. And then if someone has mentioned to you, it sounds like you're calling the hogs while you're sleeping, or it sounds like you're sawing wood, or it sounds like you snore really loud. And then they say, you know what, you stop breathing every now and again while you're sleeping, you might need to check in with your doctor because you may have what we call sleep apnea. And that can cause your blood pressure to be a little high as well. Because we can treat that and your blood pressure would come down. The next thing we'll talk about is really kind of exercise and weight control. So what you'd want to do is not necessarily lose weight, even though that's a good thing if you need to lose some weight for your health, but you want to stop any weight gain that you may have. So if you've been increasing your weight in a way that is not healthy for you, you want to kind of plateau or stop that so that you're no longer gaining weight. And then whatever your activity level is, trying to be more active. And so, has anyone ever seen a sport before? Yeah. So they're usually like a preseason, and then there's a season. So the main deal. So the preseason is when you're getting ready, prepared for the big game kind of thing. So what I generally tell people is that kind of exercise, if you've not done any exercise before, it's the same concept. So you want to prepare your body for that exercise. And since we're all sitting now, I know we can do that. So that's the first thing I typically have people do, is to sit down. So you sit down, and you stand up. And you sit down, and you stand up. And you sit down, and you stand up. And you just keep doing this. Yes, ma'am. I'm going to stop doing this in a second.
So people with arthritis, bad knees, that is not a good exercise right there.
Depending on your thing, if you have a bad knee, usually you can get
down
to about right here. Before those knees start to crunching and cracking and doing that thing. But here, I've engaged these big muscles of my leg. I've engaged the muscles of the butt. I've engaged my back muscles. I've engaged the stomach muscles. So even getting to there, what that does is gets those muscles prepared for exercise, because most people's exercise is walking. And what muscles do you use when you walk? The muscles of your leg, your butt, your back, all these things. So preparing yourself for that, so as you engage in your walk, and then you keep on progressing to a jog or a run or not, then or walking farther or faster, you've prepared your body to do those things and reduce your chance of injury. So our goal is to get some exercise at least a half hour, 5 times a week. And if you can't do 5 times a week, doing 60 minutes a few times a week. So you want to get at least 150 minutes to 300 minutes of exercise. So you want something that's going to raise your heart rate a little bit and maybe cause you to sweat a touch. Conversational pace, but not, we having a real good talk, Yes, ma'am.
Well, you mentioned sweat. I've heard people say that they don't sweat at all. They work out, but they don't sweat. Why is that?
Everyone's a little different. That's not an issue that I have, but but it's not uncommon for people to not sweat a lot. They may though need to hydrate better, because there may not be enough fluid in their body to create the sweat they need, because your body will hold on to it if it doesn't have enough. So, other ways. This is not a doctor telling you to drink alcohol. This is not a doctor telling you to drink alcohol. This is not a doctor telling you to drink alcohol. But if you do, if you're a woman, do not drink more than 1 drink a day on average. And we're talking an ounce of hard liquor, a 12-ounce beer, a small glass of wine, so not the big vessel of wine.
So you're gonna have all 3 of those?
No,
in one
just one. On average, yes, ma'am.
Yeah, so I see that you say 1 drink per day. What if you don't drink per day, and then on that weekend, What if you make up? Can you still?
So we don't want to, it's just like we were talking about sleep and you can't really catch up. We don't want you to catch up on what you missed during the week. He's like, I didn't have anything for Monday through Friday, so I'm gonna get my weekday drinks on Saturday. Because that's what we would call binge drinking. So that's also an unhealthy pattern. And so you'd want to limit your intake of alcohol. And if you are male, that's 2 drinks.
Why do the men get 2 and the women get 1? Some women got a lot of testosterone, built a little different. I got broad shoulders. I can't have 2 drinks. He can't.
Yeah. You know, like we say, everyone
I'm just asking.
is different.
Trying to be equal here.
Yeah. And, you know, a lot of the recent evidence is suggesting that we should just not drink that much, period. But if you do drink, try to limit it in your amount.
I have one other question before you get to the tobacco. Now, you know marijuana is coming out, it's legal. How do you feel about marijuana and blood pressure? Because they have CBD, which has some good things. I enjoy it. It helps me sleep at night.
Yeah.
So, and I'm just, what do you, in medical marijuana, they're prescribing it for a lot of things. How do you feel about blood pressure and marijuana?
It does not cause your blood pressure to elevate. And if it results in a more relaxed state, so if stress
we can replace the alcohol
if
with
stress
the
or
marijuana?
pain was the reason why you know, are using marijuana or CBD, then it may help in lowering your blood pressure. And I don't have any good evidence around kind of how it would impact your blood pressure, but it does not make it go higher. That I do know.
Great thing.
Stop the alcohol.
That's a good question.
Yeah.
But we do know, though, that tobacco, so cigarette smoke, will. So if you do smoke, do your best to stop. Don't smoke it, don't chew it, don't buy it. There's nothing kind of that's helpful about it in any way. And so it would just cause your blood pressure to go higher.
One other thing, I'm sorry.
Good.
So you got tobacco up there, but you know a lot of people are going from tobacco to vaping. And does that do the same thing to your blood pressure in your body as tobacco or smoking it in a cigarette or a cigar?
Good. That's an excellent question. It depends on what you are vaping. And generally we don't always know all the things that are in there, just like we don't always know, or we don't know all the things that are in cigarettes. So depending on if nicotine is the thing you're vaping, then it can cause your blood pressure to go up. And then all the other chemicals that happen there. So I generally recommend, if you're using vaping as your step to quit, there's no kind of solid evidence around that, because a lot of people stop smoking cigarettes, start vaping, and just keep vaping.
Without it still has the nicotine.
Right, without a good plan to get off. And that would be when we would engage in our smoking cessation program, so helping the people to quit smoking, because we have some professionals at the clinic who can help people to kind of that journey from smoking cigarettes to quitting. All right. Well, those are the things I wanted to discuss today. And so next up we have Kelly Ruby, who's one of our esteemed clinical pharmacists.
Hi everybody, my name's Kelly. Like Dr. Gilliam said, I'm one of our pharmacists here at NorthPoint, and I get to work in the medical clinic with your doctors and nurse practitioners and help people figure out how to take their medications and help your providers figure out the best medications for you. And so today Dr. Gilliam talked about some things that you can't change and some things that you can change. And so sometimes, even if you're changing all those things that he talked about, sometimes your blood pressure is still high. And there's also those things, right, that he said you can't change. So that's where medications come in. Sometimes you can be doing all those things right. You're getting your sleep and you've cut back on salt, but your blood pressure's still high. Or sometimes life's still just stressful and sometimes that bag of chips is still there. And so medications are what can help with that. And those things that Dr. Gilliam talked about, each of those can lower our blood pressure so much. And the same goes for medications. So we can give you a medication, and that's going to help bring your blood pressure down. And sometimes what we find is people need more than one medication to bring their blood pressure down. And sometimes people ask me that, like, why do I need so many medicines for my blood pressure? And I think that's a good thing, is we have a lot of different types of medications so that we can give people multiple medications if they need to get their blood pressure down. But the most important part about getting those to work is taking them. And that's easier said than done. So who here would say that they're really good about taking their medications every day? A couple of you, raise your hands. So that means you get called on. So tell me, what do you do to help you remember to take your medicines?
I take it at the same time every day.
Same time every day. I love that. One of the things that I recommend for people is to have a routine or a pattern. And so that helps us often remember. If it's the same part of our day and we're remembering to do it, we're going to be more likely to take those medications. Okay, what about you?
They're sitting next to my earrings because I have short hair and I'm going to wear earrings every day. So when I get up in the morning, I get dressed, I see what earrings I'm going to wear, and I just have a bottle of water there and take my medication.
Perfect. Yep. So having them in sight where you would remember them and know you're going to see them. Perfect. Does anyone use a pill box?
No.
I do. Mine are in a pill box. You know what? Yes, I do. I use one.
Yeah. So I actually love pill boxes for a couple of reasons. One, it helps with that, am I seeing it? Do I remember to take it? And this is especially nice because some days I'm like, oh, did I remember to take my medicines? Did I remember to give my kid their medicine? So I can look at it and say, oh, today's Friday. Are my pills still in there for the day? Yep, oh, I need to take them. Or nope, okay, I took it already. It's also nice because once a week you can sit down and fill up your pill box. And that way it's a good reminder, if there's not enough in the pill bottle, that you need to call your pharmacy and get your refill. And to give them a few days to get that done and ready for you. And sometimes I see people use these wrong. Sometimes I see people put all of their medicines in one spot and the next medicine all in this spot. It's really supposed to be, that's the medicines you're supposed to take for that day. So if you take something, one tablet a day, you're gonna drop it in. If you're supposed to take 2, you might put 2 in. And you might need more than one of these. So if you take medicines in the morning and you take medicines in the evening, then you might need 2 of these. So I'm gonna pass these around. You can take pill boxes for yourself. And if you take medicines more than once, take more than 1. So aside from a pill box, any other things people might do to help them remember to take their medicines?
They put an alarm. Oh, sorry.
Oh, no.
An alarm. Yes, I love an alarm. And I see a lot of you have cell phones sitting around, right? They're usually not too far from us. So I really like using the alarms on a cell phone to help remember. So you can just use the kind of the clock function on your cell phone to set an alarm. Or there's actually some fun apps out there that are specifically made to help people remember their medications. Yeah. What else?
Oh, I was going to say the same thing. Setting
Same thing. Yeah, so I'd say those are some of the big things, is having it be part of your routine, having it somewhere accessible where you might see it and be reminded by that, giving yourself reminders, whether it's a Post-it note or a sign to help you remember, an alarm on your phone, and using tools like pill boxes can all be really helpful. Because if you don't take those medications, what happens is usually that next day or that day, your blood pressure is going to be higher. So like if you came into the class today and you hadn't taken your blood pressure medicines last night or this morning, your blood pressure is going to be higher than it normally is because you didn't take them that day. Maybe you took it today, but you missed it 3 or 4 times this week. Your blood pressure is also going to be higher because you've not been taking it regularly. Yeah.
If you forget to take your medicine, can you double dose it?
Yeah, that's a good question. It often depends on the medication as to whether it's one that we would tell people to take it or not. Usually if it's the same day, it's probably okay to take it if it's a once-a-day medication. If it's getting later in the day, then I usually say no. And sometimes medicines have to be taken twice a day or 3 times a day, in which case then, if it's getting close to that next dose, no. But again, that can be really specific based on the medication you're taking. So that's a really great question when you're picking up your refills to ask the pharmacist about this medicine specifically. What do I do if I miss a dose? Yeah. And that brings up a good point. Sometimes people don't take their medicines because they forget, but sometimes people don't take them because they're having side effects from their medications, right? And when you're not taking them because of side effects, that's a time that we really want you to talk to your pharmacist or talk to your doctor and let them know I'm having this problem with the medication. And sometimes we can give you some tips or things to make it better, or sometimes we might need to change your medication. What we don't want to happen is that you stop taking your medication because you had a side effect and just forget about it, and then 3 months later when you show up, you're like, well, I stopped taking that medication because of this. Because then that means now your blood pressure is going to be high for those 3 months, instead of letting us know so that we can give you another medication and keep your blood pressure really well controlled.
What if you take your blood pressure medication for years and your blood pressure is always great? Can I just stop taking my medicine?
Yeah, that's a good question. I wish, right? Usually people still need to be on it. It could get to a point, remember Dr. Gilliam was showing you those good blood pressures, high blood pressures. Sometimes people do get off their medications, so I'm not going to say it's a never thing, but sometimes people lose a lot of weight and they start exercising and they change their foods and they're doing all those things that Dr. Gilliam talked about, and sometimes we are able to lower people's medications or have them take lower doses. That's something we want you to work on with your doctor, so that you're not just stopping it, because it could be that your blood pressure is just going to go right back up.
Okay, so you did say something I was just thinking about. So it's possible you can get off of it.
It is. Give you some hope, right? Do all those things that Dr. Gilliam talked about and have a healthy lifestyle and get your sleep and do all those great things that are good not just for your blood pressure but for our health overall. One of the other things I want to talk about is timing of medications. So I mentioned sometimes people have medicines that are taken once a day, sometimes twice a day, sometimes even 3 or more times a day, which we try to avoid because that's hard to do. A lot of people take their medicines in the morning. How many of you are morning medication takers? Yeah. I think our mornings just tend to have more routine, so it's a little bit easier to take those medicines in the morning because we have more routines often in the morning as we're getting ourselves ready for the day. And so if that's when you can remember to take your medicines, I think that's great. There have been a couple of studies, though, where they looked at having people change their medicine timing from taking it in the morning to taking it at night. And with that being the only change that they made, it helped lower the blood pressure just a little bit. So if you were someone that was right on the border of your blood pressure being just a little too high, that might be a change that you can make without having to change any of your medicines or anything else and can lower the blood pressure a little bit. I don't recommend that if you're taking a water pill. So if you're taking something called hydrochlorothiazide, furosemide, spironolactone, then we don't have people take those at night, because then what's going to happen?
You have to go.
You're going to be peeing all night, and then if you're peeing all night, then you're not sleeping well, and we already said that that's not good for your blood pressure. So not a good one to do for the water pills, but if you're taking something like losartan or amlodipine, those are things that we could have people move to their bedtime and might help. That being said, if you're going to forget to take it at night, then we're going to stick with the morning. But that's sometimes a change that we can make to help with your blood pressures.
Is it important to tell your doctor that you're not taking the medication, or is there a way that your doctor will know that you're not being honest with your doctor?
We do, yes, really want you to tell us you're not taking your medication, because like I said, we have multiple medicines that we can use to lower your blood pressure. So if you come in and your blood pressure is high and we think you're taking your medicine, what we might do is increase the dose or add on another medication. And then what can happen is then if you start taking them, all of a sudden it's too much, and we could actually make your blood pressure go too low, and then you don't feel good. And so we do want to know if you haven't been taking your medication, and we often want to know why you're not taking your medication, because sometimes it means we just need to give you some tips, or we might need to give you a pill box, or it could be because you're having side effects and we can change things. But yeah, we do want to know. Can we always tell? Some medicines, yes, and some we can't. And so with your blood pressure, if you tell us you've been taking your medicine, and we might suspect it. Sometimes they can call the pharmacy and check and see if you've really been refilling it. But otherwise, we're going to usually trust you. And if you tell us, yep, I'm taking it every day and I'm really great about it. Or if you're honest and you're like, well, I'm missing it a couple times a week. It's very helpful. And it really is important in how we choose, along with you, the next steps and the next plan for you. Next thing I want to talk about is checking your blood pressure. So how many of you were given a blood pressure monitor from us? Only a few of you?
Yes.
Okay. Good. Why do you think we want you to check your blood pressure at home instead of just in the clinic?
To recognize how, if it's running high, if it's running low, what's your normal baseline, if your medication is working, not working.
Yeah. So how often are you with us in the clinic?
Not often.
Not very often. You're at home a whole lot more than you're with us. And so instead of just having a little window of what your blood pressure is when you're in clinic with us, if we have you checking at home, we can get a much better idea of how is your blood pressure doing overall. And especially too, right, somebody said they were rushing in here because they couldn't find a parking spot and it's stressful. And sometimes we stress you out, right? Like some people get a little nervous around us, and we know that. So it's nice to see what your blood pressures are at home. And so that's why we give you those blood pressure monitors. The one you got from us is one that we think is a good quality one. But if you're ever buying one yourself, we typically have people avoid those ones that just go on the wrist. They're usually not very high quality ones, but we like the ones that go up on your upper arm. And again, this is a point if you're out in the community or buying it at a pharmacy, you can talk to your pharmacist and find out a good one to purchase. Most of you have the Omron ones that you got from us. And so when you're checking your blood pressure at home, we want to make sure we're setting you up to get data that's going to be useful for us. How often do you think you should be checking your blood pressure at home?
Every day.
Every day? Good.
Once or twice a day?
That'd be like A+, but we probably don't need to have you check it that often at home. I usually tell people 2 or 3 times a week is plenty. So if you recently had a medication change or you notice your blood pressure is trending up, then we're going to have you checking a little bit more often, and maybe you do want to check more like 3 or 4 times a week. But otherwise, we don't want you to have to stress about it. It doesn't have to be an everyday thing, but a couple times a week, checking your blood pressure. And what we're having you watch for are trends. Is your blood pressure starting to creep up? That's a sign, call the clinic. We want to get you in for an appointment. But if it's holding steady, then you're like, oh, things are doing pretty good. I know my medication's working and I'm feeling good. I need to come in and just follow up on my normal schedule. Okay, when you're checking your blood pressure, what should you be doing?
Relax.
Sitting. You should be relaxed. Not talking.
I normally see some people lay down.
Yeah. Nope, we usually want people sitting when they check their blood pressure. Sometimes there's a test we might do when people are in the clinic where we check their blood pressure laying down, standing up, sitting down. But typically if you're at home, we want you to be sitting. We want you to be relaxed. What should you be doing with your arm?
It should be about elevated to your heart.
Or depending on which one you have.
Yeah, so we want, when you put that cuff on, we want it to be at like just above your elbow, and we want your arm to be at your heart level. So that often means you need to be sitting at a table where your arm can be supported. What should you be doing with your legs?
Feet flat on the ground.
Feet flat on the floor. Yeah. And feeling comfortable and relaxed. So somebody mentioned smoking earlier, right? And Dr. Gilliam taught you what does smoking do to your blood pressure? Raises it up. So we don't want you to smoking right before you check your blood pressure. So waiting at least a half hour after you smoked before you would check your blood pressure. And another plug, come in, see us, and quit smoking. But simple things too, even just like talking while you're checking your blood pressure can cause it to go up. Listening to other people can even raise your blood pressure. Needing to go to the bathroom and pee. So having an empty bladder, sitting comfortably, your feet are flat on the floor, your arm is supported, and you're quiet and relaxed. And this is a good time. Solange did a wonderful job earlier helping us go through a breathing exercise. I think it's a great time to practice those breathing exercises while you're checking your blood pressure to help kind of calm you down. And I even have people do that when they're in the clinic with me, is to make sure they're taking some deep breaths to try to relax a little bit as we check that blood pressure.
I've heard people say when they come to the clinic, and I think I have a friend that's like this, come in the clinic and their blood pressure goes high, white coat syndrome.
Yeah, yep, exactly. Yep, white coat hypertension we'll call it. So there are people that their blood pressure is fine everywhere else, but they get kind of nervous when they come into the clinic and their blood pressure's higher. So another great reason why we have people check while they're at home. Yeah. Any other questions? Otherwise, soon we're going to have you all practice checking your blood pressures, and we'll walk you through the steps. All right, so we're going to check someone's blood pressure. So these are things that we want you to be doing or not doing while you're at home. So there's good ways to take a blood pressure and not good ways to take a blood pressure. So we've got our student volunteer here. What do you think she's doing really well, or what's something she should be doing differently right before she checks her blood pressure? uncross the legs. We're going to have you uncross your legs. So feet are flat on the floor.
Flat. You can't get to her arm or get a great or good reading if she has that jacket on.
Right, so we prefer that it be on bare skin or just a thin shirt. So yep, if you've got a heavy sweater or a sweatshirt or coat on, you should take that off. What else?
Feet flat on the floor.
Yep, feet flat on the floor. Sometimes we do prefer to have the back supported to some extent, but it's hard for some people to get their feet flat on the floor and back supported, so comfortable. I think she's ready. Okay. And she's sitting here quietly. She's not distracted, so we're going to have her not talking, not having the rest of us talk at her too much. Hopefully she hasn't smoked recently and has used the restroom recently, so she's nice and comfortable. All right. And then we'll get the blood pressure machine ready. So this is kind of nice and easy. It's color coded. The blue is going to go right in here to the blue outlet. And these are designed for people to be able to use them themselves at home and to be able to slip your arm in here. So you'll slip your arm in here. I'll let you do it all yourself. So one thing I like that you really did is you made sure you got it above your elbow. So we want it between your elbow and your shoulder, just above your elbow. But oftentimes on these, there will be a picture, or I'll show you, and this one has a picture. We usually want that cord going down the center of your arm, kind of at that spot where they would draw your blood. So it means you'll need to twist it around a little bit. Keep wiggling it over. You might need to reattach it so it gets above your elbow here a little bit. And then I have you sitting at the table here so that you can put your arm on the table to have your arm supported. So we like to have the arm supported so that where the cuff is about at your heart level. We don't have a lot of things here with us. Sometimes they would even have, we might use a machine for you to prop your arm up so that it's a nice heart level. So we don't want it dangling down or that you're waving it around, that you're holding it nice and steady, heart level. And then I usually have people take a nice breath in and blow out and do their best to relax. And you'll just hit the start button and the cuff will inflate. Many of the machines come with a memory. And so I often have people either write down their blood pressures if they don't have a memory on it, or even if they do, write them down and bring that sheet of paper with them when they come into the doctor. Or sometimes I even have people bring their machine with them, and then we compare what their machine reading is versus what our clinic reading is. And that's sometimes helpful to know when people's blood pressures are often higher here at the clinic, but they're low when they're at home. Lets us know that, yep, their machine's working right. They just tend to be higher when they're here at the clinic versus at home.
What if you get a high reading? What do you do? Do you just say, this is it? This is my number?
Yeah, so it'd make a difference as to whether that reading was unusually high for you or if that was typical. So if your blood pressures have always been high and it's kind of holding steady, just making sure you're following along, taking your medications, following the recommendations we've given, and that you continue on with the follow-up that your provider recommended. If your blood pressure is usually normal and suddenly it's high, then that would be a concern. And it depends on how high it is. Dr. Gilliam went over those numbers earlier today. You know, if it's like the 140/90, I probably wouldn't panic and call the doctor and run in right away. But as it's getting up into the 160, 180, those are numbers where we'd want you to get seen relatively soon, especially if those are abnormal numbers for you.
So is it possible, I think what I was getting at is taking it a second time and then taking the best number. If, you know, you wait a few minutes, you take it because it could fluctuate. Okay.
Yeah,
okay.
It's actually our policy in the clinic if someone's blood pressure is high that we should wait a few minutes and check it a second time. And that's a good practice to do at home too, is to wait a few minutes and check it again. Some people would average those two numbers out or just check it a second time. And again, writing those down and bringing them with you when you come in.
So when you check your blood pressure, is it always going to be on the left, or can you switch? Or
Yep, you can check on different sides. Mm-hmm. Yep, in this case we did it because that's the side that the table was on. In this case it's a chair where you could flop it around and check on a different side. But depending on how your situation is when you come in, or even in our exam room, sometimes it just depends on which way that room is set up and facing as to which arm would be closer to the desk that we might choose one arm over the other.
Hello, everyone. I'm glad you're still here with us. I'm going to be the last speaker. Well, the last speaker with a lot of information. I am so happy to see all of you here. I am Karen. I'm one of the dietitians at NorthPoint. And today we're going to finish this up with talking about your food. We've heard a lot of good information. Would you agree?
Yes.
All right. Some of that information talked about stress. Stress has so much to do with your health. It has a lot to do with your emotions and the food that you choose. I'm going to be talking about that food today. Balancing the bite, balancing what we're doing when we're eating, thinking about it, our choices, because we're here for you. You make the choice. Would you agree? Yes. All right then. So let's say we are going to make dinner tonight when you leave here, and you're going to have dinner. And you've heard all this information. So what's the first thing you might make or think about making? Is it home? Is it in your refrigerator? Is it ready to go? Or you have to go by the restaurant and pick it up? So tell me what's going on. What would you do?
I would go to the restaurant.
You go to the restaurant. Anything else? Come on, everybody. Let's be creative. What else would you do?
Stop by a grocery store.
Stop by the grocery store. You've been sitting there all this time. And don't you think that's kind of creating a little bit of stress for you? And maybe that's why you're choosing to go into the restaurant? And maybe you have to go to the grocery store? But sometimes, what my mother would say, if I'm shopping all day, I don't want to go home and cook. So the restaurant is not a bad idea. But all of these things are kind of bringing out the stress. And we're thinking about, well, I don't know if I'm going to eat it all, but we do need you to eat. Food is medicine. See what it says up here? Food is medicine. Medicine from the standpoint that it's not like a pill, but you get so much from your food if you're making the right choice. There's no good or bad, but we want you to make that right choice, not the perfect choice. How many of you ever heard of food is medicine? Okay, you've heard that before. And did you think a pill would do it instead of eating the meal? Come on now. What do you think? Because some people do. They say take a pill, okay? Well, food is medicine. Sodium. We've heard a lot about salt. We've heard a lot about salt. When you think of high blood pressure or hypertension, high blood pressure is when you have a pattern of high blood pressure. When you're thinking of that, I want you to know that salt has sodium in it. So when you hear the word salt, we're also thinking about the word sodium. How many of you heard sodium before? Okay. Have you been told, it's not good for you? Stop eating it? They're wrong. You never stop. It's a natural mineral that's in our foods, but it's a lot of salt a lot of sodium that's in salt. But you see how it's written right there? It said eat less salt. Imagine there was 1 teaspoon of salt and we put it on the table. Okay, 1 teaspoon of salt, we spread it on the table in a little circle like that. Okay, and then we wrote eat less salt. Well, that's a lot of salt that you can see the words in there, right? Well, we're thinking about our sodium intake for the whole day. For the whole day. What does it say up there? How much the average person eats in sodium in a day? Anybody? Tell me what it says up there. 1,500. And the very top one. Most Americans consume how much sodium in one day? 3,400. 3,400. If you have high blood pressure or hypertension, we're looking at 1,500 milligrams. 1,500 for the day. So, anybody courageous enough to tell me what they have for breakfast?
A Chico stick.
A Chico stick. Anybody else? Another breakfast. What did you have?
2 scrambled eggs and Ezekiel bread.
And Ezekiel bread and 2 scrambled eggs. Anybody else? I'll say what I had this morning. I had some cheese and I had some sliced apple. Okay? Right. So when you think about those things, first of all, let's give a hand for the people that ate something. Come on. Give a hand for people that ate something. You ate something. Now, some of you ate some things that may be higher in sodium. What did you mention again that you had? Chicos. Tell people what that is.
It's a coconut candy stick that you get at the corner store. I went in there to get gas, but I hadn't had one in a while, and I wasn't able to stop and get breakfast. So
Remember we talked about stress? And sometimes that stress can cause us to make different choices about our food. She said she hadn't had one in a while, so she grabbed it, right? Did it taste good? Excellent. We drive our choices not only by our stress, but what we're looking for and how the food tastes. And so if we're telling you only 1,500 milligrams in the day, who's thinking about that at that first thing you buy or the first meal you eat? Are you thinking about it? No. But we're asking you to rethink. And if not rethink, start thinking about it. Because that one choice that you make can affect your blood pressure. Would you all agree? Yes. All right. So we said 3,400. It says greater than 3,400 milligrams a day. So let's think of what that might be. Let's say if someone had 4 slices of bacon, 2 sausage patties, some grits. You know what grits are, right? And some people cook grits with salt. Some people put butter in the grits. Now, can you get unsalted butter and salted butter? Yes. Okay. So if you use salted butter, so you got the sausage, the bacon, the grits with the butter, and some people put cheese in those grits too. Okay? And then we're going to get some, let's say, 2 slices of bread. Should it be whole wheat or should it be white?
whole wheat.
Whole wheat. So let's say we got all of that. How many of you would guess how much sodium that is so far? And if you don't know the answer, as we continue in this discussion, we're going to add it all up. Okay, what do you think, though? You think we're over 3,400?
Yeah.
Yes.
How many raise your hand think we're over 3,400? I agree with you. I think we're over 3,400. All right? So here are some of the reasons why we may be over that 3,400. Processed foods. Anything in a package has salt added to it, and that salt, we've already said, has lots of sodium in it, right? Okay. Now, sodium is naturally in some foods, like fruits and vegetables. But you think it's the same amount that's in the processed foods? You're correct. No, it's not. So let's think about that meal we talked about. What was the processed foods? Help me out.
That
we just talked about for that breakfast.
She said
the
bacon.
cheese.
Bacon. What else?
And sausage.
Sausage. What else?
Cheese.
Cheese. What else? Oh, you're looking at the picture. Somebody said bread. Yes, bread's going to be high in sodium because they're adding salt to make the bread. You're right. Okay, what else in that meal? Anything else? What about the butter in the grits?
Well, it depends on if it was on. You never said if it was salted or unsalted.
Good point. So what did we use? Did we use salted or did we use unsalted?
Salted to be healthier.
Okay. We're going to use unsalted to be healthier, but we've already added the cheese. We already got the bacon. We already got the sausage, okay? And we put some cheese in there too, all right? Now we realize oftentimes people don't think of bread having high salt, but it's in there. Bagels. Anybody know how you make a bagel? When they make the bagel, they take the dough and they make some salted water and they put that dough after they shape it in that salted water and it soaks it up. Yeah. But bread also, regular bread, can be high in sodium or high in salt. How many of you do you think that salt was the kind of thing we use in our food to make our food taste good? Do you think that was the original purpose of salt?
No.
What do you think it was?
Preserve.
It's a preservative. Thus, processed foods. So they put it in there so it'll last longer. Okay? So, with that said, what else on this picture that you see up here that's high in salt?
The Maggi seasoning.
The Maggi seasoning. So when we think of Maggi, we call them Maggi cubes or bouillon cubes. Yeah. And different people have different names that they call them. But yeah, sometimes they just say Maggi cubes, bouillon cubes. All right? But all of these things are high in sodium. Let's look at the sandwich up here, the burger. Tell me about that. Break it down for me. What's in there that's high in sodium?
Bread.
The bread. What else? The cheese. The pickles. Okay?
Mm-hmm. French fry.
I want everybody to know at this point, Dr. Gilliam, Kelly, myself, we're not saying we don't want you to enjoy your food. We want you to enjoy your food. It's about how much. Okay? Portions matter. I'm a big stickler about portions. Go back to that breakfast. 2 slices of bacon is a portion. Try not to have bacon and sausage together, all right? 1 patty of sausage, all right? Try to use a little bit of salted butter if you're going to use the butter, or you can use spreads, like different spreads that have less amounts of sodium, all right? Try not to have the cheese. And one thing this burger has that that's important, it has tomato and lettuce. Fruits and vegetables, as we heard from Kelly earlier, contain potassium, magnesium. These kind of natural minerals will help regulate your blood pressure. Is that enough on that sandwich to really do any good? No. All right? No, it's not. We want you to have more than that. We're going to talk a little bit about that in terms of meal planning. How many of you heard about meal planning? Meal planning is not dieting. Dieting is that right now, right in front of you, you have some nuts, a package of nuts, okay? Some people, that's all they ate all day, that's their diet. If they had water all day, that's their diet. If they have cabbage all day, that's their diet. Sometimes people go in the hospital and say nothing by mouth, that's their diet, okay? But I want you to think about meal planning. And meal planning is the choices that we make in our food. And it's also an opportunity to put together things that are going to work for us. I got some goodies here for you, okay? Take one item and pass it along. And we're going to talk about that meal planning right now, okay? As we do that. There's lots of goodies in there. Dig deep and see what you can find in there. And whatever you get, we're not criticizing you. No one's judging you. We're just trying to use this as a way to think about how we're putting things together, okay? How we're putting things together. As you continue to do that, let's see what we got so far. We got popcorn. She has some nuts in front of her. I think there's some other little snack items in there, maybe some dried fruits and nuts. There's like a little granola bar thing. There's different things in there, okay? All right, so fruits and vegetables. Fruits and vegetables. There's a diet called a DASH diet, which means dietary approaches to stopping hypertension, okay? There's another one called the Mediterranean diet. Both of these are meal plans where they're putting foods together to help you manage your intake and understand that how these foods will help regulate the blood pressure too. Both of those diets have one thing in common. They really increase your intake of fruits and vegetables. How many of you had a fruit or a vegetable today? Okay. How many of you had more than one a day today? How many of you had more than one? Okay. Yes. Anybody more than 3? Okay. Most people maybe only get it 2 to 3 times a week of fruits and vegetables. Some reasons are people don't like them. Another reason is that people don't know how to cook them. Another thing is they go bad quickly. And sometimes they're expensive. And I said sometimes because it's where you're going to buy them at, what time of year you're going to purchase them, and what type of fruit and vegetables you're going to buy, fresh, frozen, or canned. All of those things are sources of fruits and vegetables.
Oh wait, I did have 2.
You had 2?
Yeah, I had lime in my water.
She had lime in her water.
And I had an orange earlier.
Orange earlier. So let's talk about portions. Lime in her water. Is that enough? No. Okay. Is lime a fruit? It can be considered a fruit. Yeah. But it's about portions. Usually about 1/2 cup to a cup is a serving. A 1/2 cup measuring cup or 1 cup measuring cup. So I don't think you had enough there with the lime, okay? And even with that, fruits and vegetables not only have the minerals and the vitamins and the moisture, it also has what we call fiber. She has some olives in her tuna. Did she have enough in that? Do you think she had enough in her tuna?
How much tuna she ate?
Depends on how much. Yep. Which one though?
Yeah,
no, come back. You said it has sodium in it too. She mentioned tuna and she mentioned olives. Which one has the sodium?
The olives I know for sure. It depends on what kind of olives, because I think of the green ones.
If the olives were in a jar, they are high in sodium because it's processed. If the tuna is in a package or a can, it's processed. What if that package of tuna said low sodium tuna?
Still.
It's there, but it's just lower, okay? What if it says reduced sodium? It's there, but it's less, okay?
Even if it's in white, say water, it's still sodium.
It can't, because I buy mine in the little vacuum pack, and I get the one that says 25% less sodium, and it's in water. It's still there, okay? All right. So we're making this meal, and we've got these packages. We want a fruit. I would suggest a fruit or a vegetable at least at each meal. I try to say 3 meals a day. If you're doing 6 small meals a day, that's fine. What do you do if you're going to fast? There's different kind of fasting. You know that, right? Yes. There's a dry fast. There's the intermittent fasting where you wait so many hours, to eat. There's all kind of fasting. There's some people that fast and say, well, all I'm going to do is have fruit, and maybe I'm going to have fruit 2 or 3 times a day. I, as a dietitian, have found that when a person says they're fasting, I'm asking them what they're doing. You got to think about that, because I'm asking you to think about your choices. We started this conversation about those choices, okay? So we're going to make this meal. We already know we need to have fruits and vegetables, at least a serving at each of your meals. It would be good to do it in between, too. Nobody asked me about the fact that fruits and vegetables, especially fruits, can have sugar in them, right?
But it's a natural sugar.
It's a natural sugar. Can you overdo on fruit?
Oh, yeah. Yes.
Yes, you can. Yes, you can. So when we talk about eating, it's the full meal. We're talking about proteins, which is like chicken, fish, beef, pork, eggs, cheese, nuts, and peanut butter. If you don't like that and you're a vegetarian, we do something different with grains and different vegetables to get that protein in.
I have a question. When you talk about fruits and vegetables, a lot of fruits and vegetables, the skin has more of the nutrients in there for you. And that's the part that we throw away.
Okay.
Is there a way to incorporate that? I mean, like some people grind it and get a little zest or whatever, but like oranges, for instance. Some lemons have a lot of the skin of it has more. Strawberries, it's the seeds, but we throw away a lot of the nutrients.
I agree with you totally. The whole food is very important, and nutrients, fiber, lots of different things that we're getting rid of, especially when people are juicing. And when you're having the machines and we're juicing, there are certain juicers. Now they've kind of thought about all that. I bought a juicer once because somebody tried to talk me into it once. And when I saw when I juiced it and I saw all the stuff I was throwing away, I took it back. Because 1, that's my money. And number 2, it's not going in me. All right? So in most cases, like apples, pears, you do want to eat the peeling. Berries, eat it. It's fine. There are some people, it's very rare that I've seen people eat the peeling off the banana. I've heard people eating the peeling on the kiwi too. So you got to think about you as a person and what you want. You want to make sure that you prepare that fruit or vegetable that is clean and safe. And I know organic is one way to achieve that in terms of pesticides and such. But again, more expense. So there's different fruits and vegetables that you don't have to go organic. For example, if you choose not to eat the peeling on the banana, you wouldn't have to get an organic banana, you get a regular banana. Okay? So if something is already if it's inside, you don't have to get the organic on that. What if I had grapes? Would you get the organic or would you get the unorganic if you really wanted to think about the pesticides? For grapes, you'd get the organic because you're eating the peeling. You see what I'm saying? Yeah.
But don't you wash them anyway? I mean, what is the difference between organic and non-organic if you're going to wash the vegetable anyway? I know one is made with more antibiotics and they put more stuff in. This is made more naturally. So I would think I would want to wash the organic a little bit more thorough because it's being...
Typically, when you're talking about organic, you're talking about people that are they're planting and growing that in an environment where you're not using a lot of chemicals, if no chemicals at all.
Exactly, but we know what kind of chemicals they are using, and it comes very naturally.
Well, I will say this. Wash all fruits and vegetables, okay, all of them. But I think when you're talking about juicing and you're taking that in, think about this. Some things we're going to cook and it's going to kill those pesticides and stuff. But when you're talking about something that you're juicing, you're typically not going to cook that. And it's going to go inside. And that's the whole concern that people have. Okay? So the main message here in terms of the fruits and vegetables, that you eat them, you get the portions in, and you try to do at least a fruit or a vegetable each meal, or a fruit and a vegetable each meal. Go ahead.
So you said each meal to eat fruit, vegetable. What if you just eat, and I'm bad, you guys are.
Yeah,
what if you eat it all, like I eat all of my, like I eat a big salad, you know, do I still have to worry about for one meal, or do I still should be trying to chop it up? Does it really matter if I eat them, you know, just eat a whole lot of fruits and vegetables at one time? Do I still need to try to worry about eating it at separate meals?
I think it's important that you do plan it so that you're not eating a lot at one meal. And I say that for a couple of reasons. Number one, fruit and vegetables give you fiber. Fiber helps you feel full sooner and you feel full longer, okay? If you're a type person that you can't eat a large meal, if you eat just the fruits and vegetables, you're not going to be getting the protein that you need to and getting a variety of foods. Yes, you can put the protein in the salad, but how much are you putting in there to get a good amount? You want to balance it out. Remember balancing the bite. That's called the meal planning concept. There's a plate concept too. And let's say you had a plate and you had half of it, you had fruits and vegetables on one side. On the other side, you had your grains like your rice. That would be an example of a grain, or oats or whatever in that side. And then down here, you want to have your protein. So if all you had was that salad and you didn't put the right, or I shouldn't say right, but you didn't plan it to have enough protein and other things added into it, then you're just possibly eating just a bowl full of lettuce with a few specks of orange carrots, okay? That's meal planning.
Okay, and I get that, but then you get your protein, those other two meals you have your protein there, so that's, I'm like,
I like where you're going with that. I like where you're going with that. Here's breakfast, here's lunch, here's dinner. Protein, protein, protein. You want to spread it out. Meal times and meal spacing is two or three pieces of the meal planning process. We need to get back to the meal planning around hypertension. Can we go back? Okay. As we look at all of this, on these pictures right here, you got the bagel, you got your meat, you got all these things to put together. And if we look at the burger, you have the burger and the fries. The fries are a vegetable. It's a starchy vegetable. Okay? And that's fine, but you don't want to have a half a plate of fries. Okay? And if you go to a restaurant, you said you're going to a restaurant, can you ask for unsalted fries? Yes, you can. That's meal planning at the restaurant. Can you ask for more lettuce and tomato on your sandwich? That's meal planning at the restaurant. Protein every meal, fruit or vegetable every meal, or fruit and vegetable every meal, and looking at your starchy foods. The bread is the starch. The potatoes is the starch. Okay, that's how you put it together. Dr. Gilliam talked about weight control. Your weight can affect your blood, if it's too high, it can affect your blood pressure, okay? It's the potential to, all right? So if you're managing your portions and you're getting a variety of foods, is that helping you manage your weight? Yes. So what if you had a drink, you had a soda? You got this nice meal that you planned out. What if you got a soda? Milkshake, chocolate milkshake. Does that change everything?
Oh, yes.
How does it change? Does that milkshake affect your blood pressure?
Not necessarily.
Not necessarily.
You fed a healthy plate
and what else could you do, depending on the portion too?
And you can order a small instead of a large.
Small instead of a large, but you got all this food, and let's say you get a large strawberry shake, okay? It may not be affecting your blood pressure, but it could be affecting your weight. Because at your meals, you want to, as you're balancing the portions and what you're putting together, we're also trying to work on our calories as well. I don't talk about calories a lot. I like to talk about portions. If you manage portions, you manage what? Calories. You manage calories. And fat. That's another thing that the Mediterranean diet and the DASH diet does. Mediterranean diet talks about good fats, olive oils, Okay, good fats. There's other ones, avocado oils. There's different kinds of oils now. They can be expensive. And even though you got a good oil, does it mean that you still deep fry? Does everybody know the difference between frying and deep frying? Okay, if you're doing with this much or more of oil, that's deep frying. Let's say you put a teaspoon or a tablespoon in there. Is that deep frying? No. Okay, so as we look at all of this, we know these are things we have to be mindful of. And we've talked about cooking in a way. In a few minutes ago, we were cooking. But I wanted to talk quickly about cooking with salt. Oftentimes, I ask people, do you cook with salt? And they'll say, oh, no. Then I'll say, well, you cook with seasoning salt? And did you guys know that seasoning salt is salt? Mm-hmm. Okay. Some people didn't realize that. They don't understand that if it doesn't say salt, or if it does say salt, that it's still here. Lemon pepper. What do you think about lemon pepper? Yes. Mm-hmm. Yes. One of the ways to cook differently to reduce your sodium is to cook with half the amount of salt, either half of the seasoning salt and half of the regular salt. But I would suggest to you only cook with one, not both. What about when people add soup? Like during the holidays, they'll make dressing, cornbread dressing. Now there's stuffing and there's cornbread dressing. There is a difference. I'm from the South. And sometimes when people make their cornbread dressing, they'll put soup in it, like cream of mushroom soup, cream of celery soup, chicken, all these things. Did you guys know that canned soup is high in salt? Oh, yes. Because why is it high in salt? It's in a can and it's processed.
But you can look for the lower sodium.
You can look for the lower sodium.
But it's still there.
It's still there. And she had mentioned the chicken broth. If you get the bouillon cubes and you add all that in there too, still got a lot of salt. Okay? What else could you do when you're decreasing the salt to make it taste good? Anybody have any suggestions? Come on, there's some cooks in here. What would you do? Nothing? In some things you just don't cut back on. Is that what you're saying? Okay, there's herbs like rosemary, thyme, oregano. There's some herbs and stuff that you can use. There's vinegars. Most vinegars don't have sodium at all. And some of them are flavored with garlic or flavored with thyme, and like thyme as an herb, rosemary. There's different flavored vinegars. How many of you heard of, what's that dark one? It's the dark color one, and I love it too. I can't figure it right. Balsamic vinegar. Balsamic. It has a little bit of a sweet taste to it, and oh, it's very good. You can put that with some olive oil or some just a little bit of oil in that on a salad, and you wouldn't have to use dressings. Great things. I want you to think about different things that you can cook with to reduce the salt. And another thing, always taste your food before you add the salt. So you cooked it, you ready to eat it, and then let's say you got that salt shaker on the table, and you say it's there, you add it. No, you let it sit, taste it to see if you really need it. Okay? So reduce your sodium in cooking to half the amount you're cooking with, thinking about all the different ingredients that may have salt in it, and also taste your food before you add salt. How many of you ever had a roasted potato, sweet potato? Nothing more than you roast it in its skin. You don't have to put any oil on it. And then you cook it and it gets soft. You take it out of the oven, you add it to your meal, you taste it. You don't need nothing. You don't need butter. You don't need cinnamon. You don't need sugar. If you've never tried it, try it, try it.
What are you talking about?
I'm talking about cooking a sweet potato, roasting it in the oven.
I have to.
Try it. It's very good.
It is good. You put it in aluminum foil.
You could do it in aluminum foil. You don't have to put it in foil. Another one is corn on the cob.
Oh, wow.
Wow. You don't have to add salt to it.
Okay.
And you have to retrain your tongue. Some of us are used to that salt taste. If we decrease it, where is the salt? And earlier we talked about things that are lower in salt. If we use the things that are lower in salt to cook with, we have a tendency to do what? Add more salt to make it up. All right? So I want to finish this up today with the packages that you have in front of you. Turn your packages over, please. You're going to look for the nutrition facts. Look for the nutrition facts on your packages. The gentleman in the back, you have peanuts, right? The peanuts. Always when you're reading a label, look for the serving size. Sir, what is your serving size? It's at the very top of the nutrition facts.
It says one pack is
One package. Just about everyone has a package, and I think everyone's serving is about one package. Am I correct?
Correct.
All right. So when you find that one serving, you go down and find what you're looking for. We're looking for sodium. Find the sodium. All right? Can I pick on you one more time? What's your sodium for your one package serving?
it's 200 milligrams.
200 milligrams for one package. Are those salted peanuts? Yes. So unsalted peanuts probably wouldn't have as much sodium. And let's see what everybody else has. Let's go. We got a white cheddar popcorn, and we got, I think, a regular popcorn. Well, is yours regular? Oh, you have the kettle corn. So for yours, is yours one package? Is the serving? How much sodium?
90 milligrams.
90 milligrams. Look at his, 200. What's yours in the bag?
Mine says 70.
70, and it's for that one size, right? Look at that jump. 200. What was yours again? 90 and 70. Oh, you have the regular popcorn. What's yours? It's 8. Go down to sodium. Help her out there, friend.
Oh, here it is.
What's the sodium for yours?
I'm reading it wrong.
It's 80, I think, 80.
They're all different.
Yeah.
They're different.
This one is lower.
40 milligrams. But look at that. White cheddar, kettle corn, and they're all the same brand. You have to look at your labels. One time, a friend of mine told me, he said, I've never seen somebody looking at labels like you look at labels. I said, I'm a dietitian. But you don't have to be a dietitian to look at labels. There's another important part of the label that other than the nutrition facts. It's the ingredient listing. Find the ingredients on there. It's a little area, it'll say ingredients, and it'll tell you what's in that. Everybody found it? This is how it usually works. The first ingredient is usually the highest amount. So everything that comes after that is decreased. Okay? Okay? So, you know, you don't have to get really, really serious about checking labels, but I really, really want you to check some labels sometimes. Can we do that?
Yeah.
How many gonna try? Are y'all gonna try? I got a winner. I got a winner. So we've cooked a little bit. We've meal planned a little bit. We've seen some things that are high and low in sodium. And one, I did say I was about done, but I add one more thing. Water. Make sure you get your water in because we want to flush things through. And everybody's different on how much water you need. But I say drink some water. And I know sometimes they'll say all fluids count, like tea, soda, and what have you. I think nothing's better than water. And when I go out to eat at a restaurant, and I do, I always have water. I don't get a soda, I don't get a shake, I get water. I don't get sweet tea, I get water. And I'm not downing anybody for the choices you make, because let's go back to the whole conversation. When I talked about stress and how stress affects your choices. And we're here today to talk about your choices, and you're the only one can do that. And in your families, with your children and your husbands and your partners, what have you, you're making choices of what you cook. You're making choices of how you cook it. So make some choices that's going to make some good food for medicine choices. Do you agree? All right. Remember, it's about common sense food rules. Eat real food, fresh fruits and vegetables, not too much, the portions, mostly plants, fruits and vegetables. Thank you, everybody. I'm going to have Dr. Gilliam come back and talk to you.
Well, thank you, Karen. I mean, that was great. I contend that, you know, the things we're eating, the things we put in our body are as important as anything that we do, because good things in, you get good things out. And so what we learned today is that we need to check our blood pressure. So if you don't know it, check it. If it's high, we can do things to bring it down. In addition to that, we learned about ways that we can control that blood pressure. We just heard from Karen about kind of eating right. We learned about sleeping better. We learned about not smoking, reducing our alcohol intake. We learned about decreasing our stress. From Solange, we learned about getting regular exercise. And we learned about kind of working with our weight to get it in a place that's healthiest for us. And so I would encourage you to take something that you might have heard or learned from the day that you didn't know before, and just choosing that one thing to make a shift or a change, even if that's adjusting the timing on when you take your medication, if you take medications. Now, if you liked what you heard here today, and we thank you for joining us at this introductory ABCs of high blood pressure group, we would invite you back to our next group, which is Karen, all for the full group. So you get all that energy, all the knowledge around food. You get that for a full session where you get to get into the details of all those food items, all those questions that you may have to figure out how you really kind of can manage your blood pressure through your diet. And then if you really want to kind of dig deeper into your wellness and mindfulness and movement, because we know that stress and exercise are big parts of this as well, join us for our Bodies and Minds in Motion for our third group session, which is an hour and a half with Solange and some other clinicians to kind of guide us through those practices. And again, I thank you all for joining us here and welcome you back for our next set. Thank you.
Awesome. Thank you.